big problem is in healthcare, is the escalating costs of healthcare, and we do recognize those problems and need to address them. But the question is whether we do that through giving government complete control or giving patients control over their dollars. The big lie that has been put out there is that our healthcare system is a failure of the free market, that our free market has failed and we need to have government come in and intervene. But the fact of the matter is that government already controls about half of healthcare. About half of healthcare dollars are being paid for out of the government through Medicare, Medicaid, hospital subsidies, and all these other programs. And the average person pays more in taxes for the healthcare of someone else than for their own healthcare coverage. And then, of course, we have a huge number of mandates, government regulations. The government regulates insurance companies, they regulate doctors, they regulate hospitals, they regulate prescription drugs. In fact, here in Pennsylvania, I don't know if you guys have heard about Walmart's $4 prescription drug plan. Walmart has this 40 or so prescription drugs they offer for $4, and they've advertised this and have it on their website. You can go online and see what prescription drugs you can get for $4. Except in Pennsylvania, there are no prescription drugs for $4 because the state has a law that says $4 is just too cheap for any prescription drugs. So you have to pay more in Pennsylvania. And these are the kind of regulations that we have in place that drive up the cost of health care.
The other thing about the bill, and I think it's been discussed elsewhere, you've heard it referred to as a death panel. There's this concept of a quality-adjusted life year. Well, quality-adjusted life year is already used in England, and the concept is that good year and good health for a 70-year-old is worth maybe $44,000, give or take $3 or $4. Okay, so they've put a number on your life at a particular age. Okay, and they use that to make a calculation. The calculation is, well, if this medicine costs $25,000 and and you're going to die today, but you could live 5 months with this medicine, I'm sorry, the numbers just don't add up. Well, in Canada, they've gotten to the point now where if you're 57 years old and you need a hip, which costs $50,000, you don't get it, okay? And I think that if President Obama was being honest with us, he would say, read my lips, no new hips.
One thing, the number one thing that activists say to me, I'll speak at a bus stop, and then people run up to me and say, why didn't you say this? Why didn't you say this? There's so much to say about this. And the first thing that they're interested in is, when are the members of Congress going to stand up and say, I'm going to be the first one to get on this plan. I'm going to create this government-run plan. It's going to be so fantastic. Where can I sign? I'm looking for the line to sign on. That's the first thing they say is, why, my congressman hasn't said that he wants to be on this plan, so why does he want to put me on it? And so that is hitting a huge nerve with people. People. Another thing that we're seeing, and this kind of combats the whole notion that people are fake out there, or that there's some kind of grand poobah somewhere who pushes a button and all these people run out of their houses or something. These seem to be the kind of ideas that we're encountering.
In your experience in Pennsylvania, what will be wrong with government health insurance?
Well, basically, it's not solving the real problem. It's not addressing the root cause of the problem, which is the problem is not the uninsured. It's the fact that health insurance costs are skyrocketing, and that's largely driven by government intervention. So simply having another government program is simply going to exacerbate those problems rather than solve the problem in healthcare.
What do you see as a result of the town hall meetings that are going on about healthcare?
Well, I think a lot of politicians are starting to rethink their position on the healthcare plans that have been introduced, and are starting to realize that the people are not happy with a government taking over healthcare.
Around the state of Pennsylvania in a bus. Why did you do this, and what was the reaction?
I did this because a lot of people can't afford to come to Washington, D.C. for a rally, so we're actually taking the healthcare rally to them, and you'd be amazed to see people coming out. They're so excited that we're coming to their towns and thanking us for coming because they need an outlet, and they need a place to send the message to their local officials, to their representatives, that hey, it's your constituents in our communities. They don't have to leave their community to send that message, and I think that's what's so awesome about the bus tour.